Advanced care planning is a process. In New Zealand, advanced care planning is a process. The focus is on understanding what is important now and in the future. The process of exploring your hopes, goals, worries, and care preferences by thinking, talking, and sharing what matters most to you and your whānau. Understanding what the future might hold for you and your health, what care and treatments are available, your options. Using that to support care and treatment planning and decision making. We have a number of tools to support people, their whānau, and the members of their healthcare team during this process. Firstly, an advanced care plan. This records the person's hopes, goals, worries, and treatment preferences, and may also include advanced directives. Advanced directives are a consent or refusal to specific treatments that may or may not be offered in the future when the person is unable to communicate their consent or refusal. The next tool is the Serious Illness Conversation Guide. This is a guide to support healthcare staff talk about advanced care planning with seriously ill people. You can see it's a scaffolding or structure with conversation prompts. It guides the clinician through setting up the conversation, seeking permission, checking the person's understanding of their health and what may be ahead, sharing a prognosis, and then exploring the person's priorities, worries, and what gets them through the tough times, their critical abilities, and what they're willing to go through for more time, and then closing the conversation with the recommendation and affirmation that the clinician will do everything he or she can to ensure the person gets the best care possible. The next tool is Shared Goals of Care. The Shared Goals of Care principles and forms support advanced care planning during a hospital admission or during the time a person is in an aged residential care facility. Shared Goals of Care are when clinicians, patients, families, and whānau explore the patient's values, the care and treatment options available, and agree the goal of care for the current admission, and if the patient deteriorates. The Shared Goals of Care principles provide guidance to healthcare providers on developing and supporting a Shared Goals of Care approach and outlines what is required for Shared Goals of Care discussions with adult patients, their families, and whānau. The Shared Goals of Care form supports the discussion with prompts and space to document the discussion on the one side. On the flip side is where the Shared Goals of Care plan is documented, the goals that will inform the care and treatment decisions should the person deteriorate. There are a number of other tools to support the advanced care planning process, including Te Waka Kakarauri, Whenua ki te Whenua, Te Ara Whakapiri, and many others that can be found on the Advanced Care Planning website, www.myacp.org.nz. Let's now look at how these come together. The Advanced Care Plan and Advanced Care Planning ideally starts early before a serious illness. It should then inform any subsequent Serious Illness Conversation Guide conversation. The information gathered in the Serious Illness Conversation Guide supported conversation should be recorded and added to the Advanced Care Plan. The Serious Illness Conversation Guide supports Shared Goals of Care discussions. The key points of that conversation are recorded on a Shared Goals of Care form and inform the recommendation or goal of care for the specific hospital or aged residential care admission. The Advanced Care Plan and Planning should inform that Shared Goals of Care conversation. On discharge, the information and recommendations might prompt a review of the Advanced Care Plan. Let's now look at how this plays out over time. Imagine advanced care planning as a set of overlapping sound waves that expand and contract over time. The relevance and the level of advanced care planning activity for a person and their whānau expands and contracts over time, triggered often by life events like when you update your will or when someone you love or care for becomes unwell, or you might move house or need increasing support with your daily activities, or you start struggling with your short-term memory. And health events like, a visit to the GP, diagnosis of a chronic or life-limiting illness, a health complication like a fall. And in between times, a person and their family might spend no or little time thinking or talking about advanced care planning. And as it expands and contracts, the person will use their advanced care plan to support their thinking, talking, planning, and sharing. Let's now look at this from the perspective of interactions with the healthcare system, when what matters most to the person and their whānau, their preferences, are discussed and used to plan ahead and to inform care and treatment. These can be times where advanced care planning can be supported, for example when talking about support in the community, or generally with the GP. Maybe when the person lands up in hospital or as their health deteriorates. If they potentially lose capacity, and particularly in those last weeks, days, and as they die. These are all opportunities for advanced care planning, using what matters most to the person to inform their care. Now let's look at how various tools that support advanced care planning might be used. The advanced care plan is relevant and should be added to, used, and reviewed throughout the process. It should inform discussions with the GP, on admission, during admission, whilst receiving care in the community, or in age residential care. So, for example, during a GP visit, the GP or practice nurse might refer to it, or if the person has become seriously ill, they might use the Serious Illness Conversation Guide to support that conversation. On admission to a hospital or an age residential care facility, the healthcare team will want to determine the direction of care and agree shared goals of care, should the person deteriorate. This should start with reference to any advanced care plans and documented conversations. The clinician might use the Serious Illness Conversation Guide to help structure the conversation, and should then capture any shared goals of care or treatment decisions that result, and on discharge any new information should be shared with the GP to prompt an advanced care planning review and to care plan in the community. If the person loses capacity, the advanced care plan and any documented conversations or discussions should inform the treatment and care planning and provision. And as a person is dying, we should honor the person and their whānau's wishes by using the information we know about the person's preferences, what matters most to them, to provide care and treatment that best matches that. So to wrap up, advanced care planning is a process of discussion and shared planning for future healthcare. It involves an individual, their whānau, and healthcare professionals. Advanced care planning gives people the opportunity to develop and express their preferences for future care based on their values, beliefs, concerns, hopes, and goals, a better understanding of their current and likely future health, and the treatment and care options available. It is our responsibility to ensure that each and every one of us supports the process and uses the information that people share with us. Matine, mamano, karapa te whai. By many, by thousands, the work will be accomplished. Unity is strength. Ngā mihi.